Hi, hello everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. I know you all have to be tired of hearing my voice. And so today we've got a really great surprise panel that's going to be taking over the webinar. We've got the amazing folks from Greater Flint Health Coalition, and we're going to be talking about improving health together. So I'm going to pass the baton to Nicole Smith-Anderson, Senior Director of Programs for Greater Flint Health Coalition, and just shout out the entire team. A thank you for bringing this wonderful, credible, important messaging to the webinar. So thank you for being here.
For sure. Thank you all so much for inviting us today. We're really happy to be here and excited just to be able to educate more folks about all the programs that we have here at the Greater Flint Health Coalition. So I just want to take a couple minutes, get started with a high-level overview, and then I'm going to hand it off to some of our amazing team members, and they're going to tell us more about their programs in particular. So just a little bit of background. Our organization is a broad partnership of healthcare providers, insurers, public health, nonprofits, business, education, all sorts of multi-sector entities. And we were founded in 1996, and we really utilize that collective impact strategy when we're dealing and interacting with our multi-sector partners. We play two roles in the community primarily. So we're a neutral convener and backbone organization, meaning we bring all sorts of folks to the table to solve these bigger problems that we have in our community. And then we also operate a variety of community-based programs, and that's what you'll hear a lot about today. Just a little bit more information about our organization. Our mission is to improve the health status of our residents and improve the quality and cost effectiveness of our healthcare system in our community. Our vision is also to have a healthy Genesee County and beyond community practicing healthy lifestyles with access to the best and most cost-effective health and medical care and the assurance of the conditions of optimal health for all people. You can also see our focus areas as well. I'm now going to hand it over to Brianna McGarry, and she's going to tell us a little bit about some leadership changes that we've had at our organization. So, Bri.
Thanks, Nicole, and hello, everybody. Can you hear me? Something just popped up that said unmute myself, but I did.
You're good. I can hear you.
Okay, thank you. So I'm Brianna McGarry. I am the Director of Policy and Partnerships here at the Coalition. That is a new position that was created as a supportive role for our CEO, our new CEO, which is former Senate Minority Leader Jim Ananich. I've had the pleasure of working for him in mostly in the legislature, but in varying capacities for the past 12 years. And he served on the Greater Flint Health Coalition board for 9 years before being overwhelmingly or unanimously elected to be our new CEO by our executive board. So he and I both started January 3rd. He served in the legislature for 12 years, the past 8 as Senate Minority Leader. He started off in the House and then transitioned to the Senate after there was a vacancy and he won a special election. So he has also a teaching background. He has worked as an education coordinator at Priority Children, and he also served on the Flint City Council for 4 years, where he was president for 1 year. So he's got a very vast career in public service, which we really, I'm biased, but I think that everyone on the call would agree that can be used as a catalyst to really grow the organization, and also just to build new partnerships. And not that we don't already have enough here being a convener, but yeah, so we're really excited to have him. And he is happily married to his wife, Andrea Ananich. She's a teacher at Flushing Schools, and they have an absolutely adorable son, 7 years old, named Jacob. So when he's not here, he enjoys spending time with them. And yeah, any questions about him? Then happy to answer. I know him pretty well, worked with him for a while, but yeah, we're happy to have him on the team here.
Thanks, Bri.
Yeah.
I think now what we're going to do is take some time to just do an overview of our various programs, really in an effort to make sure that individuals in our community know what's available to them. So I am first going to turn it over to Penny Poplar.
Good afternoon, everyone. My name is Penny Poplar. As Nicole stated, I'm the Senior Director for our Flint Healthcare Employment Opportunities Program. We've been around for a little over 21 years. Our program is a healthcare sector workforce development program that focuses on assisting our community members with training and employment needs in the healthcare field, while also working with our employers on their workforce needs. We work with some great partners in the community, consisting of our 4 major healthcare employers in the community, our local healthcare educational providers, and our funding partners and resource partners. We're also a service provider for GST Michigan Works, which means anyone in our community that is interested in receiving services or training for healthcare, they are referred to our program. Our program has 3 major goals in mind: to assist with the skill shortage in entry-level, mid-skill, and high-skill healthcare career occupations. We're able to do this by assisting people with education and financial assistance, supportive services, and career exploration. We also work with our employers to improve job placement. We're able to do this by continuously developing a talent pipeline to fill those new and vacant positions. Advancement by working with their current employees to help them grow, build their skills, and move up within the organization. Improve awareness for career opportunities in healthcare and increase sustainability careers. We're able to do this by working with our employers, doing yearly surveys to figure out what their needs are and training in those areas for viable employment. And again, doing this yearly just to make sure everyone is able to go into healthcare and fill those open positions that our healthcare employers have. There are 4 ways to enter our program. We have our entry-level pathway, which is for people with little to no experience. Our advanced pathway, which is those that may be seeking higher certificates, associate's degrees, or maybe even some business bachelor degrees. Also, our employer-sponsored referral pathway, which is normally those that are working in maybe entry-level positions in healthcare and looking to move up. Employers will refer them to our program. And then last but not least, our career ladder program, which is for those who have come through our program now looking to elevate their careers and gain more educational and work experience. So what do people receive as they come through our program? They're able to receive free tuition assistance. This is not a loan. They do not have to pay it back. We pay for your classroom time, your tuition, any books or materials that are required. Career advisement. So they work very closely with our career advisors to help them develop their educational and career plans. Supportive services to help them get through our program. So if they need assistance with transportation, clothing, mileage, whatever they need to help them get through their process. Empowerment sessions. This is our way to continue to pour into our participants that come through our program by providing them additional employability skills and community resources. And last but not least, that job development assistance. We have personal connections with our HRs in our community and just work with them to develop that personal handoff to our employers. Also, we have our life skills and career exploration training. This is more so for our entry-level participants that come into within the organization, just to make sure they have the skills they need to go into healthcare. So it's a structured environment that focuses on interpersonal and workplace skills. We developed this program based on what our employer needs are. We review this curriculum every year to determine if there's anything additional to add. And its main focus is healthcare entities, specific skills needed, and then those basic skills needed to get through to work in a work environment. As I stated earlier, we also work with our healthcare employers on their workforce needs. And one of the programs we're able to offer is our OJT, which is on-the-job training, where we can pay up to 50 to 75% of someone's training time. It really helps employers develop that personal training towards a specific position, and then also assists them with cutting down on the cost for training. We have a few employers listed that have participated and took advantage of the OJT opportunities. We also have our subsidized employment, which is for our out-of-school youth, 18 to 24. It's special for them to gain work experience. We can pay up to 100% for 200 hours for someone to gain that work experience. Allows employers to kind of pour into students and become mentors to them. Also help fill vacant positions, but they can hire them on permanently once they complete. And last but not least is our summer youth work experience. This is for 18 to 24-year-olds. We've developed a special program for them to get on the job experience first, then decide if they're interested in training. Last year was our first year completing it. It was very successful. We had 10 students. 5 were able to gain full-time employment and 4 entered into higher education. And just to give you a few outcomes for over the last 5 years, we've assisted over 608 students, 84% healthcare credentials, 90% have gained employment, and our average wage at this time is $18.43.
Thank you, Penny, so much. And I will ask all the presenters, once you're done, if you could drop your contact information or any other info that you want in the chat, just so people have it. I'm now going to turn it over to Kristen Stevenson.
Hi, everyone. My name is Kristen Stevenson. I am the project manager for Flint Recast, which stands for Resiliency in Communities After Stress and Trauma. Recast is a program that here at the Health Coalition, we're really honored to be partnered with the city of Flint on. It's a 5-year, $5 million grant from the federal government, SAMHSA, and we are, in addition to partnering with the city, our other partners include the Crim Fitness Foundation, Genesee Health System, and Michigan State University. And so I'll talk a little bit about what kind of each of them do on the program. Our role at the Health Coalition is to just ensure that the program is running and implement all of the various components in collaboration with the city of Flint. And so some of our overarching areas of focus you can see on the screen include promoting the use of trauma-informed practices and expanding the trauma-informed first responder community. So lots of trainings and partnerships around trauma-informed practices, building up organizations' capacity for youth support and development opportunities through our mini grant program, access to behavioral health services through our partnership with Genesee Health Systems, evidence-based comprehensive approaches to violence prevention, partnering with law enforcement, including some of the other collaborative efforts happening across the city, mental health literacy trainings, as well as expanding capacity for self and collective preservation across kind of all activities that we're doing. In the realm of behavioral health, we've got our main efforts include working with Genesee Health Systems to provide free mental health trainings to the community. So you can kind of see the flyer here, but we offer mental health first aid, question, persuade, respond training, mental health 101, trauma and resilience. These are all free trainings that can be found either on our website, flintrecast.org, on our Facebook page, as well as Genesee Health System. Encourage all people to participate in these trainings. We also do, we're focusing on, also looking at, just wanted to call out our Talk About It Tuesday videos that we post on our Facebook page, having discussions with mental health professionals, community leaders, community members, just about what it's like to deal with mental health. So those are exciting videos that we post on our Facebook at least once a month. Race and equity, here we have our biggest effort on that has been up to this point allowing for community participation in determining how our mini grant funding will be spent. So you'll see that if you haven't already on our website through Vote, you can actually vote one time a year on our community mini grants and what organizations get funded. We release all of our quarterly and annual reports on our website. This year, we got to launch our first annual Strong Summit, which we intend to do for the next 3 years of the grant and hopefully beyond as well. Super awesome opportunity to bring the community together to connect and learn and really take action on mental health. Next, youth support and development with our partner, the Crim. We do mindfulness integrated sports. So we fund them to do a lot of the sports that you see at all of the Flint community schools. Our mini grant program, where we fund all of the different community mini grant organizations through the process where you can vote on our website, but then we also allow, we have a scoring committee that helps us every year decide which organizations will be funded. And then also encouraging youth mental health first aid training for different organizations with GHS. public safety and violence prevention. Our number one sort of effort around that has been working again with the CRIM around community and police training around mindful leadership, which has been, this year was our second year with that pilot program. Hugely successful, I think, especially the second year, and looking forward to the future years of continuing those efforts. Again, same thing with our Strong Summit. These are a couple images from our Strong Summit this year where we were able to have leaders in the community around who are working on exactly improving police community relationships. So some really great insights from those folks at our summit that we'll look forward to continuing in coming years. And then our evaluator, Michigan State University, we have all of our program partners provide data that we then ultimately submit to our funder. MSU conducts an assessment to the community to assess the baseline of mental health. So we have this is also available on our website. You can see over the years, really since about 2016, we've been tracking this. You can see what the baseline for mental health has been. Then of course our grantee organizations complete surveys, and then their participants will also complete surveys. And like I said, kind of throughout, we have a Facebook page. Encourage everyone to go check out our Facebook page for more information, as well as our website, flintrecast.org. And I'll put my information in the chat.
Thank you so much, Kristen. We are now going to hand it off to Kelly Ainsworth, and you'll probably notice as we go through this presentation, we have a lot of programs that overlap, and we really do work collaboratively within our different programs. So Kelly, the floor is yours.
Awesome. Thanks, Nicole. So I'm Kelly Ainsworth, Director of our Mental Health and Substance Use Initiatives here at the Health Coalition. So this big map you see in front of you really is the guiding force for all the work that we try to do. When you say the words mental health and substance use, there's a lot packed into that. So we created a community-wide strategy to really look at all the different aspects of mental health and substance use and how we go about addressing the different needs, looking at the different gaps, barriers, resources, approaches, so we can make sure that we have a community that is thriving and not just surviving when it comes to their mental health, when it comes to their relationship with substances. So we have a kind of a strategy and objectives and activities for prevention, harm reduction, treatment, behavioral health, recovery, and also just those basic needs, thinking about that whole person, because we know that someone is not defined by their mental health, by their relationship with substance use. They're whole people. They are defined by many different things. So we wanted to have a map that really reflected that and looked at all of the different community partners as well that can be involved in those various activities. So it doesn't matter if you're a law enforcement officer, it doesn't matter if you're a health system, if you're a community member, if you're a treatment provider, there's a role for you in addressing the impacts of the opiate epidemic and other emerging substance abuse trends that we see in our community. We can go to the next slide. Talking about that whole person approach, we really wanted to find a way to have a continuum of crisis care for our county. So we have so many different wonderful resources, programs, services that our partners help us provide that we love to connect with. We wanted to make sure that when we open one door, that it's not just that one door they walk into, especially in those moments of crisis. So you'll see we have crisis response coordination for people who are dealing with substance use issues. We have a peer recovery support initiative that's called our quick response team that I'll talk about in a little bit. We partner with GHS and the behavioral health urgent care, so people can connect to that if they have a mental health crisis that they need to deal with. We work closely with our Mid-Michigan CHAT program, Community Health Access Program, that you hear about in a little bit as well, making sure that folks' social determinants of health needs are met. So like food, transportation, healthcare, whatever it might be, we want to make sure that people are connected to the things that will help them be well. Wellness looks different for everybody in different stages. And so we know that connecting person to one resource should hopefully be, and with this model, is a way to connect to a depth of other resources to help that person achieve whole person wellness, not just wellness in one specific area. And go to the next slide. This is just a snapshot of some overdose data for Genesee County specific. I know this is really tiny text. This was taken from the Michigan Overdose Data to Action dashboard that the state of Michigan has put together. This is updated regularly. This helps us understand overdose trends in terms of by gender, age, different areas of our community. It really helps us direct our strategies and how we communicate to our community different trends, where we put resources like Narcan and fentanyl testing strips, where we have our peer recovery coaches go. We really use data every day to make decisions on how we specifically address the opioid epidemic and other trends here in the county. Next slide. In addition to state data, we also do a yearly opioid awareness survey. Our next survey will be coming out in the next few weeks, so we'll make sure to connect all of you folks to that survey when that is available. But we wanted to just gather some baseline data that we can monitor over the years, looking at, do people feel like the opiate epidemic is still an issue that's impacting the community with different things like the water crisis and COVID and other major community issues? Did people still feel like that's something that's impacting their community? And overwhelmingly, we've had 80% or more that say yes. But then we dive deeper into questions like, do you know what the signs of overdose look like? Do you know what Narcan is? Do you know how to use Narcan? Where would you go if you needed prevention or treatment information? So looking at that data helps us develop strategies such as making sure the community does know the signs of opioid overdose, because you can't administer Narcan if you don't know an overdose is happening. So we use this data to direct our strategies and make sure that we're providing the information that our community is telling us that they need. Going on to our quick response team, this is our peer recovery coach initiative. We've been around since 2020. We partner with New Paths, GHS, our community health access program, to provide connection to treatment at the bare minimum for people immediately after an overdose occurs. We do this by connecting with our first responders, law enforcement. You'll see in the bottom there, we're partnered with the Sheriff's Office, Grand Blanc Township, Flint CDPD, Flint Township, the 911 Authority, the Medical Control Authority, which is the governing agency for all of the EMS in Genesee County. We have a digital referral platform that they can make referrals for folks on the scene of an overdose. So if someone refuses treatment, say they don't want to go to the hospital, our team is called and we say, hey, we've got a peer recovery coach who's been through what you're going through right now. They've lived through addiction. They're in recovery. They can help you navigate the system. Our goal really is to increase entry to treatment, increase access to support resources that can help that person be well, and reduce opioid overdose related deaths and really any sort of overdose or substance use issue that a person is facing. We want to help connect them. Go to the next slide. Some of our great outcomes that I wanted to just briefly share. Just this year, we have had just under 550 QRT referrals from hospitals, first responders, community partners. We've had over 2,300 client engagements with our peer recovery coaches and our care coordinators who kind of help set up that aftercare once a connection to a coach is made. Several referrals to CHAP, Mid-Michigan CHAP, to connect to those basic needs resources. We trained over, and that's actually a lesser number than it is. I would say we're probably near like 80 law enforcement officers we've trained this year so far. We have over 10 partners with law enforcement and EMS. We're well over 5,700 of those pocket cards you saw on the last slide. We hand those out to connect people to our resources. It has a phone number and a text line, so you can call them 24/7, any time of the day, and a coach will answer and they will connect with you. Our coaches are distributing naloxone or Narcan, which is the medication to reverse an opioid overdose. They go out twice weekly, distributing almost 4,000 Narcan kits just within this year, and then over 2,000 fentanyl testing strips. The picture you see here, we partner with Genesee Health System to power the vending machine, the Narcan vending machine that they have at the MTA station downtown. The Health Coalition and the Quick Response Team are proud to supply the fentanyl testing strips to support people testing their drug supply before they use, because we know that fentanyl, which is a synthetic opioid up to 100 times stronger than other opioids, it's being unknowingly or knowingly mixed in with other drugs. So methamphetamine, cocaine, heroin, which is an opioid, but it's being mixed in there. Even to some extent, we're seeing it show up in marijuana. And so we want to make sure that folks who are trying to avoid fentanyl contamination, I should also mention it's in pressed pills. So if people are buying things like Adderall or Xanax on the street and not from their doctor, it's found there. So we want to make sure that folks can test that and make sure that they are not unknowingly using fentanyl. If you aren't going to be out in the community, you don't know where to find the lock zone, we have a request link on our website. You can go to our website, put just in a little bit of information, and you can also watch a Narcan training video, which I would have loved to have shown here, but it's about 5 minutes long. And I wanted to make sure I had the time to share everything with y'all. But please go to this website, get yourself Narcan trained, request a Narcan kit, we'll mail it to you, meet you somewhere, wherever, whatever's convenient for you. We want to make sure that everybody has access to it. Next slide. Just some of those community resources I mentioned, the fentanyl testing strips, they come with instructions on how to use them, and also the signs of overdose and what to do if an overdose occurs. And also we have these rat cards available just to educate what fentanyl is and what to do if an opiate overdose occurs. Next slide. In addition to our work with opioids, we have a wide variety of resource guides for alcohol, heroin, cocaine, methamphetamine. We just created a mental health resource guide this year as well in partnership with GHS and Flint Recast. These are all available for digital download on our website. Just some great education on what overdose looks like or what use looks like, long-term, short-term health effects, and specific information on where to go for treatment and prevention for these individual substances. And go to the next slide. And then lastly, my time is up, but I wanted to, there's my timer. We have a monthly safe medication disposal program at the Genesee County Free Medical Clinic. We'll take pills, needle, syringes, we'll take liquids, you name it. We want to get that off the street, out of your home, so we can make sure that people aren't using it that it wasn't prescribed to. So come check us out. We're there monthly. And that's my time. Thanks, everybody.
Thank you, Kelly. All right, moving right along, we are going to have Elena talk about Commit to Fit. And Commit to Fit was the first program I ever worked on at the coalition, so it's near and dear to my heart. So Elena, the floor is yours.
Thank you. Hi, everyone. My name is Elena Larrea. I'm the Assistant Project Manager on the Commit to Fit program. Commit to Fit is an ongoing initiative of the Greater Flint Health Coalition focused on improving the health and health behaviors of the Genesee County residents. We work in a number of settings in the community that include physicians' offices, employers in the workplace, schools and youth, faith-based communities, community gardens. So a number of things out in the community is who we work with. We host 6 different challenges each year around different health behaviors. So those include physical activity, nutrition, water consumption, fruit and vegetables. It all takes place on our website, committofit.com, where it's a free health behavior tracking initiative for those that might not have a fitness tracker or just really want a free space to really track those behaviors. You can see here that we have our Active Schools Challenge that was most recent here in March. That's for students. So we're actively working with all the GISD schools, charter schools, private schools, where they have a chance to participate in compete for the healthiest school in Genesee County, where they get monetary donations to purchase new health and wellness supplies for their schools to really promote that physical activity during the school day. Next slide, please. We also have many health and wellness programs around physical activity and nutrition. We have 2 physical activity ones. One is Walk with Ease. This is a free 6-week program through the Arthritis Foundation, where we work with seniors and those with arthritis to improve mobility, have more confidence in their balance, different stretches and things like that. We're currently at Max Brandon Park in Flint. For that program. We also have a Rec Connect program through our SNAP Ed funding, which is 4 to 6 week program, depending on the site, where each week is a new physical activity demonstration class. So we do chair exercises, circuit training, yoga for them to constantly learn new ways to be active in their everyday life. Next slide. We also have nutrition education for all ages. So we have a senior nutrition program, which is newsletter based, focusing on healthy aging and reducing the chronic disease burden in our seniors. So we work with a lot of senior centers in the area, along with churches on that. We also have the Learning Kitchen, which is our adult program for those 18 and up, which helps participants plan and prepare nutritious meals that are low cost, expand food dollars, and really work with new ways to get the whole family in a healthy lifestyle. We also have Cooking with Kids, which is a hands-on nutrition program for adults and children. So working together as a family, as you can see in this picture here, with fresh fruits and vegetables, helping parents and caregivers learn new ways to involve children in the kitchen, and which helps them not be picky eaters and incorporate those healthy foods throughout their whole life. We also work with community gardens. So through our SNAP-Ed policy systems and environmental change, we help sites that either might have an existing garden get repairs, get new garden beds, as you can see at our Hasselbring site. We also helped Crapel Senior Center, who had an existing greenhouse that was taken out by a windstorm. We helped them get that prepared and up and going again. So now these sites and locations can produce their own food and increase that fresh fruits and vegetable consumption at no cost. We also, through Commit to Fit, have the Genesee County Food Pantry Network, which helps facilitate networking between the Genesee County pantries, food distribution sites, and other locations that work to distribute food to the community. That helps them any problem solving, any new pantries that are just starting up. Few or existing pantries could help them get started. They share food between each other that maybe a pantry received that didn't get rid of, another pantry could utilize. So we really have a great network here that can be found on our website, committofit.com, that has listings of pantries in all locations in the city, some with requirements and some that do not. Some program outcomes from the past year is our Cooking with Kids program. 97% of our parents reported their child is willing to try new foods. We work a lot with vegetarian meals and getting heavy veggies into the diet of our families here. We also have the Active Schools Challenge, which we had over 4,000 students from 300 Genesee County classrooms log over 4.1 million minutes this year. And teachers reported an increase of 86% in physical activity levels. So we are really amazed with those results. We also host our Fall for Fitness Challenge, which engages employees in the workplace at some of our organizations, which logged over 149 million minutes this past October, with a 63% increase of participants being very motivated, especially throughout the workday. These types of challenges really help those that might not have a large wellness budget be engaged and Commit to Fit, where we can provide them with free resources. Thank you.
Thank you, Elena. And she did just note it, but all of our programs at the Health Coalition are free. So as you see things throughout this presentation, they are all free. So that's very exciting. I now get the pleasure to hand this over to Amarachi to talk a bit about our REACH program.
Hi, everyone. Thank you, Nicole. My name is Amarachi. I'm the project coordinator at the Greater Flint Health Coalition for REACH. REACH, our whole goal is empowering Black and Brown communities, African American and Hispanic communities in Flint, Genesee County by providing culturally relevant community health resources to achieve healthy lifestyle. So what is REACH? It is a CDC funded program. It originally is a 5-year grant, but we have a 2-year grant. And in that time, we've had the privilege of really working intimately with partners and accomplishing a lot. So I'm grateful that we have the opportunity to do so. What's the next slide? So with the coalition, what we do, I like to say 3 pillars of our work is increase access to healthy foods, breastfeeding or lactation spaces for those living in the county. And then we also connect the dots. We connect the dots with clinics and other medical providers to chronic health programs here in the county. Oh. So For the Make Room campaign, that is one of our second pillar, which is breastfeeding and lactation spaces. We desire to have a multimedia campaign that provides advocacy, awareness, resources, and funding towards building safe spaces for Black and Brown lactating and breastfeeding moms. The whole goal is to make sure that we do it for free, so that we take off the cost for businesses, nonprofits, churches even, that would like this space for those who they serve. So we partner with YOLO, You Overcoming Lactation Obstacles, a wonderful partner who is able to do just that. So thank you, everyone.
Thank you, Amarachi. Now going to turn it over to Ashley, who's going to talk a bit about our Connecting Kids to Coverage program.
Hi there, everybody. My name is Ashley Smith. I am the project manager of the Connecting Kids to Coverage program here at the Health Coalition. Our program has been funded for the past 7 years through CMS, and we are currently under contract to be funded through 2025. We kind of initially started as a response to the Flint water crisis to ensure that the folks had the additional resources and access to the additional medications and testing and all the things that they needed. But we have since kind of expanded our umbrella. And so now we do serve all of Flint as well as Genesee County, partnering with the Genesee Health Plan, the Genesee Intermediate School District, Hamilton Community Health Network, as well as Mott Children's Health Center. Next slide, please. So alongside our partners, we do our best to meet our residents where they are at. We know that there are a lot of disparities and challenges and social determinant of health needs that are very apparent within our community. One of them is being transportation. And so on the screen here is just a little quick snapshot of some of the partners we've been able to partner with, some of the organizations we've been able to get into. And like I said, we just really try to do our best to meet our folks where they're at in order to help them enroll in healthcare coverage. So what exactly is it that we do? So the Connecting Kids to Coverage program actually helps individuals in 2 different ways. And so we assist individuals one-on-one with enrollment in Medicaid, and we are also able to assist individuals with their yearly redeterminations, which I'll speak to a little bit more in a couple seconds here. But this is a service that is available to all of our Flint and Genesee County residents. Despite our name Connecting Kids to Coverage, we actually serve both adults and children, as well as families, to be able to help them get connected to the resources that they need. And so the first way that we are able to help folks is by actually helping them with the one-on-one enrollment into Medicaid. So we actually walk them through and help them complete the application. On your screen here is just a variety of different informational pieces that are kind of key to being able to help folks complete that application. The application typically takes between 35 and 45 minutes, depending on how easily accessible this information is to our folks. In addition to if they have access to the online portal MiCHWA, where the application actually is. And so depending on troubleshooting and what is readily available can kind of dictate how long the application process is. But we do help that go from start to finish to creating that MiCHWA login all the way through them getting approved for actually having Medicaid assistance. The next way that we help is through redeterminations. And so during the COVID-19 public health emergency, redeterminations were actually put on hold, meaning that they were not happening, or if they were happening, Medicaid health plans were not able to essentially turn individuals' Medicaid off. So they had continuous medication, they had continuous coverage through Medicaid over the past 3 years. But now, June 2023, so the current month, is actually the first month that these redeterminations are happening again. And so we have 2 different buckets. We have folks who haven't had to do one in 3 years and might not remember exactly how to do it. And then we also have folks who have never had to do one before. And so the Connecting Kids to Coverage team is here to kind of help walk individuals through that process, let them know what to expect, making sure that if they get a letter, if they get a packet, that they are actually reading those letters and filling out those packets. Because it is we are taking every effort that we can to kind of help avoid folks having a lapse in their healthcare coverage. And so what is the best way to get assistance through our program? We work on a referral basis. You can self-refer into this program. You can have your healthcare provider send us a referral, community organizations. We kind of work one-on-one with all of these different wonderful groups here within Flint and Genesee County. And the best way to do that is either going to be to give us a phone call, or you can send us an email at coverage@flint.org. And I think that's it. Thank you, guys.
Thank you, Ashley. I now get to turn it over to Janae Tyus, and she's going to tell you about our largest program here at the Greater Flint Health Coalition.
Thanks, Nicole. Hi, everybody.
I want to just tell you a little bit about CHAP. So we are formerly known as the Genesee Community Health Access Program, recently now known as the Mid-Michigan Community Health Access Program because of the map that you can see here, and that we've expanded our reach to serve people in Genesee County and those in green here, with the same goal of just making sure people don't have any barriers that are preventing them from staying connected to their medical provider. So we work with children and adults. Doesn't really matter where they live, doesn't really matter what insurance they have. Our goal is to just make sure folks have access to insurance and a doctor, and they don't have any social determinants of health needs. CHAP really does assist with primarily these 5 buckets here. So if you remember anything from my conversation today, just think about all of the ways that CHAP may be able to help you or others that you come in contact with. So our goal has always been to make sure people have a strong connection to the medical home. So that's bucket number 1 in orange, which can mean a bunch of different things. And it also involves making sure people have access to a dental home or even a specialist should they need it. Usually when we're addressing the orange bucket, we end up covering and addressing the social determinants of health needs that are preventing people from even thinking about going to the doctor and going regularly. These things really include what is around a person, where they live, work, and play, the barriers that are around them as it relates to transportation. Sometimes housing and utilities are big issues that the CHAP staff will help people overcome. We also address emergency department utilization. It's probably not an unfamiliar thing to you to know that people go to the ED for the wrong reasons. So we try to educate folks about when to go to the emergency department and when instead to stay connected to their primary care provider. We've grown a lot in that we're helping close gaps in care. So the green bucket is HEDIS activities, which really relate to things that we need to educate people about the importance of going to the doctor annually most of the time for preventive screenings, such as like getting a lead test, or even getting maybe even a chlamydia screening, or just going to the doctor and having a well child visit, and maybe even going to get immunization. So we see a great need in this space where we need to get more people to the doctor for the stuff that can potentially save their lives and keep them around here longer. COVID still hasn't yet gone away, so we are still working very closely. We are embedded at the COVID testing sites around here. We have a CHAP CHW who's there at each site once a week, where we're making sure people that are going in for testing get their arms wrapped around them and get any other additional support that they need in CHAP. We also have been distributing at-home testing kits, and I think I'm going to stop talking about that because there's a slide later that goes into that in more depth. We really work at 3 different levels. CHAP's logo is what you can see here. There are 3 individuals connected at the center because that's how we work every day. The staff primarily work with clients and providers, and then you got folks like me who work at the systems level, but we can't accomplish our goals without having all of these pieces connected at the pie in the center. This is primarily how CHAP works. People are identified as needing CHAP services, usually in an external location. I'll talk about our referral partners a little bit later. And then there is a referral process that gets the referral from someone externally who needs our help into our system. And then it gets entered and assigned to the appropriate wonderful people who then do the job of connecting and trying to get people to answer the phone and work with us to then address their social determinants of health needs. So stuff comes in the door, then stuff goes out the door primarily to a community-based agency to meet the need. We like to help people by making that connection from the clinical side to the community-based side by walking with people across the bridge and making sure in a closed loop manner they actually get the services that they need.
The team is pretty fantastic. Many of them are probably on this call, and we are a multidisciplinary team. So what you see here are a few of my staff, and we are comprised of community health workers, we have nurses, and we have social workers, plus folks like me that don't have those degrees or work with people, but we all are critical to the operations and chat. They are very well trained. They've got a lot of skills and tools in their tool bag that help them achieve connections and be extremely successful. And so we work with, at this point, over 2,000 clients a month. And so we're able to do great work because of the great people that we have on this team with all of their wonderful training. We also operate a few very important programs because lead in this community is still a thing, and we like to focus on prevention versus addressing stuff after the fact. So we operate the elevated blood lead level nurse case management program, typically across the state. That is operated by local health departments, and GFHC is the owner of this in Genesee County. So this one's a bit more long-term, where the nurses will go in the home, do some assessments, and make sure they're understanding or seeing the sources of lead, and then helping mitigate that by making connections to community-based agencies and walking with families until the kid usually retests below the action level of 3.5. Lead still is an issue here, and we consistently see every week people being referred to us for this elevated blood lead level nurse case management program. We also operate an OB lead risk screening program where we're trying to make sure people, pregnant women, really screen using this evidence-based tool that you can see here with all of the triggers we know are indicators that lead might be in the home. And our goal is to connect, provide some education, and then make some connections to some resources to make sure there's no lead by the time there's a mobile baby. We also operate family supports coordination in support of the Genesee Health System. And we also work with the City of Flint for our lead-based paint hazard control program. I already said this primarily, but we've not gotten out of the space of providing education as it relates to COVID, and we still do that. We still have a ton of resources available to help people who need help and education related to COVID-19. If we go on to the next slide, I'll speak a little bit about our chat referral sources. Remember, it's over 2,000 people being sent to us every month, and that comes from a variety of places and spaces that you can see here, all with an established relationship and probably a unique process of getting the referrals to us. If you go to the next slide, this is primarily how it works. We need the information that's attached on this referral form. People should know that they're being referred to us. We like to have consent. And then we typically have dedicated people sending us dedicated referrals in a variety of different manners. So that's chat, and that's it. Thank you, guys.
Thank you, Janae. All right, and last but certainly not least today, I am going to turn it over to Mr. Robert Reed, and he is going to give us an overview of our CASES program. Robert?
All right, thank you. So my name is Robert Reed. I'm a project manager with the CASES program, and CASES stands for the community-based approaches to strengthening economic supports. In short, we like to put money in pockets of families in Flint and Genesee County, basically show them how they can access money that they're just leaving on the table. So we do provide that economic support through programming aimed at reducing financial stress, and what's related to that, when you have financial stress, risk factors that can contribute to adverse childhood experiences. Admittedly, I'd never heard of ACEs before I started with Greater Flint Health Coalition, but as I learned what my ACEs score was, because there's 10 questions that providers use to really see if a person is at risk because of the ACEs. And that really opened up a world of conversations and reflections on my own childhood, which I brought to this program because I know that money touches every area of our life. And since the pandemic, it seems like things just have gotten more intense. It's exacerbated those situations. So what we want to do is bring that financial stress level down, provide some programming, and also help more residents benefit from available tax credits that have been proven to lift families out of poverty, such as the Earned Income Tax Credit. So this really is on the social determinants of health and health equity. Next slide. Just a little bit about this Earned Income Tax Credit. I want you all to see that it's not an insignificant tax credit. It maxes out at just under $7,000. So $6,935 is available. You do not have to have children or dependents, but you get more money back when you do have a dependent. Now, there are some qualifications based on your household income, and you see the numbers here, but rule of thumb, under household incomes under $60,000, that's for your adjusted gross income. That means if you make more than $60,000, but after all your write-offs and deductions, it's under that cap, chances are great that you've already earned this credit. You just have to claim it, because if you don't claim it, you do not get it. And there is a credit for the federal level as well as the state level. And I'm excited that the leaders at the state of Michigan have increased the level of this credit from 6% up to 30%. So that's an exciting development that's going to help a lot of families. So what we do is we really have a comprehensive approach to addressing these social determinants of health and health equity by providing free monthly workshops. The three areas that we focus on, number one, is I know when we say the word taxes, sometimes people have high anxiety, and I just made your blood pressure go up by saying the word taxes, but really taxes are year round. And so we want to provide education that allows people to know more about what's available, what their situation is, and how to better prepare themselves so that they can get the most from tax time. One success story, I ran into a gentleman who said, "Oh, I'm familiar with your program because we have increased the access points for free tax preparation services through VITA." The gentleman shared with me that he actually got back $27,000 for free because he was able to utilize free tax preparation. He was able to go back up to 3 years and claim the Earned Income Tax Credit. What that allowed him to do was purchase a duplex because he was concerned about his daughter who was getting ready to have twins. She didn't have childcare. He wanted to help. He tapped into this credit, was able to put his daughter on one side of the duplex. He lives on the other, and she has a live-in childcare. So you can just imagine that stress level going down and helping. We also have programming around the adverse child experiences. We partner with Master ACE trainers, Sharice Stapleton and Dan Doolin, child psychologists, to provide education and increase awareness, but also to create positive childhood experiences, because overcoming ACEs really depends on your support network. And then lastly, we want to wrap it around because your money habits really dictate, if you're experiencing stability or not. And so we really want to get into the nitty gritty and look at your habits. Are you saving? Are you paying yourself? And we really have a full financial wellness wraparound to help families in that regard. So that's what we do at Cases, and we're excited. You can find us. I'll put our contact information in the chat.
Thank you so much, Robert. And then this just is our last screen that has some kind of basic contact info, but we've had our group reviewing it kind of as we went throughout this presentation. And so we do have a couple minutes left. I wanted to open up the floor. I know Heather Lynn had a couple questions, and we can see where we land.
Amazing information, you all. Thank you so much for joining us for the webinar this week. I hope everyone who's been attending has been taking notes. There's been a lot of information that folks have put in the chat, so make sure that you check that out if there's a particular program or individual that you want to reach out to for more information. But Nicole, tell us what's on the horizon. What's coming up as far as events that we need to be mindful of?
Yeah, absolutely. So given that it's spring and summer, we have a lot of events and activities. And I think our busiest staff person that you'll probably see out in the community the most is Elena. And so I'm actually going to turn it over to Elena, and she's going to share what's happening or what we have coming up in the next couple of weeks.
Thank you, Nicole. So we will be having a lot of our adult nutrition education programs coming up. We will be hosting those at St. Mark Community Outreach Center, Community Enrichment Center, the Flint Children's Museum, and many more locations. I will say the best way to get in contact and registered for one of those is giving us a call or visiting our website on committofit.com. That is in the chat, and I can post that again. As far as our health education, we do have a Commit to Fit Physical Activity Outreach Week taking place the last week in June 26th through the 30th, where we'll be highlighting free fitness class options in the community through, Commit to Fit, our partners with the CRIM, Ascension Genesis. So this will include physical activity options for all ages and abilities. We'll also be launching our Commit to Fit Walk to Wellness Challenge July 1st. So that's another one of those free challenges to increase physical activity in the community. Again, all that information can be found on our website, committofit.com. With that, we also will be having a Walk to Wellness kickoff event for the community at Max Brandon Park on Friday, June 30th, to launch off that challenge starting that Saturday, where we will collectively walk around the park, which really engages everyone and shows new ways, free spaces to be active. So I'll again put the website in the chat. Thank you.
Love it. So many cool things to look forward to. Thank you. One of the things that we've talked about pretty consistently on the webinar is, overdose and naloxone and those kind of resources. You guys mentioned it too. Nicole, can you give us some more information about that?
Yeah, absolutely. And I'll probably bring Kelly on for this as well. And so we're doing a ton of work in the harm reduction space. And I think Kelly is our biggest cheerleader and leader in that area. But I know we definitely have resources available. And Kelly, I'm going to kick it to you if you just want to share what opportunities, especially organizations and businesses have to partake in Narcan.
Absolutely. So lesser known fact is that the Michigan Department of Health and Human Services actually has a free naloxone portal on their website. So community organizations, businesses, law enforcement, you name it, can go and request bulk orders of Narcan to have on hand completely for free. There's a form you have to fill out. It can be a little touchy, but I lend myself to kind of technical support as needed. I do that for law enforcement all the time. They're like, I filled out the form, but I didn't get my Narcan, so I try to help navigate that. So you can have it sent directly to you. We also provide Narcan training, so we can train businesses, we can train staff, we can train volunteers. Anytime that you have a training request or you want just to get more information, reach out to us. You can email me, my email's in there. We'll connect you. We also have Narcan boxes available to place throughout the community. We have 9-unit boxes that can go inside or outside. We also have 100-unit Narcan boxes available that are indoor. We really want to make sure that our community knows where to find Narcan, knows how to use it. It really should be as readily available as something like a first aid kit or an AED defibrillator. We know that overdose doesn't discriminate against anybody. It can happen anywhere at any time. And so we need to be prepared to act. And the Health Coalition and our, especially our quick response team, we're out there every day just peppering our community with Narcan, fentanyl testing strips, and anything else that might be of use to help people with harm reduction. We're meeting people where they're at. Not everybody's ready for treatment. And so having things like Narcan and fentanyl testing strips are just one way that we can help promote people's health and dignity and honor their choices and hopefully just keep them alive long enough to improve their health, however that might be.
Love that. And those boxes that you mentioned, are those free?
Completely free. Yeah, we
Awesome.
Totally grant funded. So we will provide it for you. We'll stock it. Our quick response team coaches will come by weekly to stock it. So you don't have to worry about, is my box empty or who's managing this? We do all of that work for you.
Wow.
So there's really no barrier to providing this life-saving resource.
Kelly, I hope you get inundated with phone calls.
Me too.
Like, that's such an amazing resource. So we are rounding out this hour. So grateful for you, for the Greater Flint Health Coalition, all of your work, for you coming and joining us this week, and us hearing about all of your amazing efforts. We want you to come back because I feel like we only got a taste. It was just a little bit of this and a little bit of that. But what we want is certainly to take a deeper dive into so many of these amazing programs. And what I really appreciate is that you're partnering with other organizations. So just really, really great way to continue the connectedness and the amazing work in our community. So thank you for that. We're going to round us out with our reminders here. If you have an idea for a topic, something you want to hear more about, or a speaker that we have not had on this webinar that we've been doing since March 20th of 2020, send it to us. Send us your ideas, send us your suggestions. We want to hear and we want to make sure that we're celebrating the work that's going on in our community. So you can email me at upholdhe@msu.edu or reach out and we'll get connected with that. Also, don't forget, we offer those continuing education units for our wonderful community health workers. That link is going to come up once you exit the webinar, and reach out if you're having any trouble with that, because certainly we want to make sure that you get the access to those units. Stay connected. We'll look forward to seeing you next week on the Flint Community Webinar.